Good afternoon, everybody. We're so glad that you've joined us for a title and topic of great importance to all of us in the Commonwealth and specifically in Richmond, and that's getting back to business, what Richmond business community needs to know about COVID-19. Peter Buckley is my name, and I have the privilege of serving as interim CEO of VCU Health System and then also as Dean of the Medical School. And I get to work day by day alongside some amazing professionals and academic leaders. And we found ourselves in a unique position that, unlike many businesses which had to defer, pause, or shut down, of course, the healthcare system, while it was constrained by making space for potential COVID patients, we were still very much open and functional and working through this, and got just extraordinary support, both moral and also support in all kinds from our community. So we're very grateful for that. But really going through this, therefore, has afforded us a experience of having kept our business open, as well as having to develop a whole series of new and unique safety and healthcare practices. And that's what we're going to spend the opportunity to discuss this afternoon, weaving that in with how that might be relevant for the business community. We're extremely fortunate to be able to have this opportunity in the first place, but particularly to be able to partner with Chamber RVA and to partner in something that is incredibly important to all of us, and that is the return of businesses in this wonderful city. So we'll spend about the next hour focusing on the pandemic, how it's changed our lives, and then what can we do as a business community, and how can we provide information and support as we prepare to reopen our economy. Again, I want to thank our partners. I mentioned at the Chamber of Commerce and RVA Chamber, but also MCV Foundation and our own health system for their support in putting this together. We have a distinguished panel. We could spend a good amount of our time going over their credentials, but we're not going to do that. We're going to go fairly quickly because you have provided some important questions, and we've also provided some material for you. The first person I'd like to introduce is Brian Anderson, and Brian is the president and CEO of Chamber RVA. Chamber RVA has been around for a long time, since 1867, and it represents our entire Richmond region, one city with 7 counties and 1 town. And Brian joined in 2019, and by all accounts, including our president, is off to a great start and is a great partner to many of us in the community. Now, prior to this position, Brian was the president and CEO of Greater Columbus Chamber in Georgia. And Brian, I'm not going to ask you this question, but it's a little known fact that during the Civil War, Columbus, Georgia was second to Richmond only in the whole of America in the creation of munitions during the Civil War. Did you know that?
I did know it, and our convention center was an art institution to that.
Is that right? Very cool. And the next is a colleague that I get to work with daily, and that is Tom Briggs, who's Assistant Vice President for Safety and Risk Management at VCU. And Tom's been at VCU since 2015. He has more than 20 years experience in providing environmental health, occupational safety and risk management, insurance, fire safety and emergency management services to both public and private entities. So we're really grateful to have you with us today, Tom. So welcome, thank you. The next person is Gonzalo Behrman, and Gonzalo's the chair of our Division of Infectious Diseases, and he also holds the Richard Wenzhou Professor of Internal Medicine and Hospital Epidemiology at Virginia Commonwealth University. He graduated originally from SUNY at Buffalo, where he got his MD and then did his Master's of Public Health at Columbia University. But he's been with us a long time. He is a terrific colleague, and then he is what you might term the most valuable person, the MVP of academic medicine in the middle of a coronavirus pandemic. So we're grateful for all your leadership, Gonzalo. And then finally, but no means least, is Dr. Richard Wenzhou, who's actually the Emeritus Professor and Chair of our Department of Internal Medicine, and was formerly the President of our practice plan, which oversees some 600 physicians. And Dick is also editor-in-large of the premier medical journal internationally, the New England Journal of Medicine. So we've assembled a great group of colleagues. As much as Zoom will allow us to have an interactive session, we're going to do that. We've left plenty of time for questions. We have over 600 people, is that right, on this program? And so if it's on your mind and we're not addressing it, shoot us a question in the chat and we'll do our best to get to it. So let's start with you, Dick. What are some of the questions that you would want business people to answer as they consider opening up their operations?
Yeah, the way that I think about this, Peter, is if I were asked to consult with a business, I would want to begin by asking a few questions. And one of them would be, what is the goal of your new program of opening up right after this surge in COVID? What exactly is your goal? And if you know you're here and you want to get there, define what the there is. And having done that, then the next questions would be, what strategic long-term goals and what tactics in the short term will you employ to get to that endpoint, that new goal, there, if you will. The third question would be one that's really rough and most people don't ask it. What's your risk tolerance is the way that it's phrased in a nice way. But what I'm really saying is how many patients, if you will, or how many of your workers who get sick will you then, raise the bar and say maybe too much? How many workers who get hospitalized? How many who get on a respirator? And how many deaths before you say, enough, I've got to stop and do something else? And then the last question would be, how are you going to measure failure or success? Exactly. And once you go through these tough questions, to be precise, then I think we're in a situation where maybe I could answer more specific questions down the road.
Great. So we'll just put those questions out there for people to percolate. I want to turn to Brian because Brian has put together a, if you like, a toolbox. So tell us about that and your regional task force.
Dr. Buckley and other panelists, thank you for this opportunity to be with you all. I'm certainly honored to have this conversation. We've been working really informally with a group of about 40 plus leaders around the region. So again, informal list, but a comprehensive group that really has worked on two things. We started back in March talking about the immediate effects on business community, how they could begin to talk about being closed for a period of time, how they could begin to understand what was available in the CARES Act, how they could begin to apply for loans and support through all of those assistances. And we've now pivoted to, the fact that that's kind of going on, they're in a place that they're thinking about reopening, to how do we help them reopen in a safe and responsible way. And so our group of, again, 40 plus leaders have been working with SIR and some other leaders to put together really two components of a plan. The first is an electronic toolbox or toolkit, for lack of a better term. It's going to be a very robust website that does everything from put information in the hands of business leaders, ranging from the governor's Forward Virginia plan to local jurisdictional rules and regulations, how a restaurant should open based on CDC and other associational guidance, how a small pharmacy would open. So that's the electronic toolkit, if you will, that'll be launched hopefully Monday or Tuesday. Parallel to that, we think there's got to be some level of confidence building. We think the psyche of business owners and consumers is very fragile right now. Everybody's not going to open if they're even allowed to per the governor's instructions. So how do we give people some confidence to either open as a business owner, but also to go out and be the consumer you were before this hit? And so to do that, we're working on a physical toolbox that we plan to distribute on May 27th and 28th at 5 or 6 locations around the region. So our businesses who register with us, we can get an accurate count, will come to a place convenient to them, pick up this toolbox, so it'll have some initial PPE, it'll have some initial marketing material around how they can tell their employees and the outside consumers that they're pledging to do safe and responsible reopening. And then third, printed copies, if you will, so they don't have to go to the website if they don't want to, but printed instructions around, if I'm a restaurant, these are the steps I should take to be safe and to give my consumers and my employees the confidence they need. So we think between those 2 actions alone, we'll help our businesses do what they want to do, and that's to project safety to their customers and project safety to their employees. And we all learn through this process. One other function we're doing specifically as a chamber is we've launched, as of today, a small business relief grant fund. There's many of those around the community, but we're doing this in conjunction with Facebook. They provided $250,000 worth of seed funding. We anticipate other businesses doing the same thing, and we hope to have a few phases of grant money available as we go through the next 6 to 8 weeks, which are going to be critical. The recovery is going to be just as difficult as the closing. And so we're trying to make sure we cover all angles with that. But I'm going to stop there and would rather answer questions. But that's a hint of what we're doing right now.
That's fantastic. That's a ton of work. You've been very busy, and it sounds like it's going to be tremendously helpful to the community. Let me turn to Tom, who, as I was listening to you, Brian, is doing kind of the same thing for VCU and is pulling together our plan, One VCU, for all our community. That's a huge undertaking. So, Tom, what's going through your mind as you were listening to Brian and as you lead our preparation?
Yeah, I mean, the 3 things that we're kind of focusing on more than anything else is the personal responsibility portion of people taking personal precautions, whether it's, and then planning for all the social distancing, whether it's within our public assembly spaces, occupancy, transportation. I saw one of the chat features on, whether it's our points of service for food service or for our registrar or for our reference library. How do we apply all of that across our enterprise, which is, it's not just our clinical settings and it's not just our classrooms, it's the broad scale of everything we do. And then it's cleaning our facilities, especially not just the general cleaning, but all the high touch surfaces. How do we do specialized cleaning in our clinical spaces and our laboratories? And then specifically in our dining areas as well. How do we apply that? And then what the part that I'm sure Dr. Bierman's going to talk about a little bit is how do we respond to positive cases? That is that's the part that really we're focusing strongly on right now, and it's in partnership with VCU Health. How do we do the notification, and then how do we do the contact tracing?
Great, that's a lot of stuff to put in place. Thank you for your leadership. You mentioned Gonzalo. Let's go to Gonzalo. So, you've been right on the front line of this. You've been an extraordinary leader, risen to the occasion and been a beacon of support to all of us. In your experience as well as your scientific knowledge, what do you think are the 3 most important things for minimizing the spread of this contagion?
Thank you, Dr. Buckley. It's an honor to be with all of you today. So the 3 things I would mention in broad strokes is number 1, testing and contact tracing, particularly for public health good around the community. Number 2 is going to be social distancing, which is critically important to prevent the risk of contagion transmission. As we know, droplets don't really travel more than 3 to 6 feet. And last but not least is personal protective equipment on 2 levels. On the level 1 is in the healthcare system, critically important to keep the frontline healthcare workers safe, but also in the community, wearing the mask probably has some benefit to prevent transmission and as source control. So someone infected is not exhaling droplets onto others. So those are the 3 things that I would prioritize.
And can I just ask you more about the social distancing? How do we know that works from a scientific vantage point?
Well, much of it is based on biologic plausibility, but our understanding is that the droplets do not travel more than 3 to 6 feet. And by being greater than 3 to 6 feet apart from others during in more common situations, not under aerosol generating procedures or procedures in the hospital, then the risk of contagion is very small. So we're pretty confident that we'll have a positive impact to decrease transmission. I should say one other thing. With pandemics, the important things or the pillars of prevention are going to be availability of testing, which we all know has been an issue for the US. Number 2, treatment, which we know is very much in development, and we don't have any slam dunk antivirals for either treatment or prophylaxis. Number 3 is vaccination, which we don't have, which leads us to non-pharmacologic interventions, which is social distancing, personal protective equipment. That's really, really the #1 priority.
Great. Okay. You mentioned testing, but I'm going to ask Dick, who's a renowned infectious disease expert, take us through the testing. You know, you can't get off the TV or go home and you're not hearing about testing all the time. So take us in a layman's way through the vagaries, as well as explain what one test is versus another, please.
Yeah, so first, just to tell you, what are we testing? We have tests available to know if somebody's infected. So we have that test, and that just tells you here and now. A positive generally implies that the person's sick. Then we have tests for antibodies, and that means in the past, have you been exposed to this virus? And our immune system responded to that exposure with the virus. The implication, and we can talk about that, meaning that people are immune, at least for some time. Now, testing is more complicated than it sounds like. So with companies, and there's something like 90 of them out there, have made tests. The FDA has approved 4 for good reason. Because the first thing you want to do with a company is say, we've looked at a group of people we know are positive now, and we ran our test, and 95% of the time we agreed, we identified 95 out of the 100. That's a pretty good start. That's called sensitivity. And on the other side, we have a group of people we know were never infected and are not immune, they're susceptible. And we applied our tests there, and in fact, 95 out of 100 said they were negative appropriately. So you start with the front end, something called sensitivity, specificity, 95 and 95, very good target. So then a new problem comes up, and that is what group are you testing with the new test? And an important point is that tests work better the more the proportion of people infected in the community are. So in Virginia, we think we have about 5%, and somebody may push it to 10. 5% of people have been infected. That's a very low prevalence. Our tests don't work well that way. So if you were out and just taking tests of all people in the state, I would tell you with 5%, maybe a little more prevalence, you're going to have 20 to 50% false positive. Fortunately, the negatives work in all situations. So where do the positives work well? Well, if you go to an emergency room filled with people in the middle of a pandemic who have cough and fever and body aches, at least half of them are going to have COVID. That's a 50% prevalence. Our tests work very well. A positive test in an emergency room patient, that person is infected. So again, remind you, if we're in a low prevalence area, these tests don't work so well for positives. And that could be a problem for business. I really would agree with Gonzalo. We need to repeatedly test the workers in any kind of business, maybe weekly, maybe twice a month, knowing that if you had 10 people positive so far, that there might be 2 or 4 or 5 who are false positive. Well, what do we do? From a public health point, we would treat them all the same. It's not very efficient, but we'd say, okay, we treat all the positives as though they were infected, do all the contact tracing, and the contacts should be actually on some kind of quarantine. From a business point of view, say, wow, that's cumbersome, that's disruptive. And that's true, but that's the state of the art today. Be happy to answer questions about this later on.
That's a huge amount of ground you covered with great ease, Dick. That was very helpful. I want to switch to another strategy. Gonzalo, you are a European by descent, so you know also what's happening around the world. And there's a different experiment going on in Sweden and some other places where really they have not shut down their businesses to any by the same degree. And they're kind of, if you like, their immunological systems taking it on the chin. Tell us your thoughts about that, and how is that? That's a naturalistic experiment going on elsewhere. How's that working out?
Well, I would say that they're really banking on the concept of the herd immunity. So the idea of herd immunity is that you have enough people in a population, let's say 60 to 70%, that are immune to a disease and thereby decrease the transmission significantly to others who are not immune in that population. Now, the classic herd immunity, the idea of the herd immunity would be chickenpox. If you've had chickenpox as a child, you're not likely, or you don't get reinfected later on in life. You're immune to chickenpox, and that's checked through antibody titers. The idea here, or the Swedish idea, is that you allow younger folk who have less risk of manifesting severe disease to become infected and hence immune, and eventually reach herd immunity, which will then protect the rest of the potentially at-risk population. It's a bit of a strategy that's let's just say it's a bit of a tough strategy for them, and I don't think it's going that well from what I read today in the New York Times. I want to say anything else about that.
So do you think we're going to have immunological passports anytime soon?
Yeah, so I think if it was chickenpox, you could probably give out an immune passport or immune passport, but we don't know enough about this particular virus. If one is infected and has antibodies or proteins of that virus, we don't know if that protects for a recurrent infection and for how long. So it's really a bit of a roll of dice.
All right. Well, let's go back to the current world. So, and Tom, tell us about kind of what we're doing in our plans to reopen, and whether you see that as a big bang event or a phased-in event and sequenced, or what's your thoughts on that for us?
Sure. I mean, like anything else, we have an incident command team that makes all the decisions for the university when it comes to these types of emergencies. And underneath them for reopening, we have different subcommittees who are developing plans for return, whether it's the Health Sciences Committee led by yourself, whether it's Health and Safety Subcommittee that's led by me. It's a phased approach. So the current state is phase one. Phase two would be bringing back clinical placements for our students and for our faculty, and also research that supports those clinical placements. And then bringing back research slowly throughout the summer, rolling into bringing our students back in the fall. And that includes all of the support activities have to be in place. All of the procedures that we've talked about with social distancing, et cetera, all have to be in place before the rest of the student body comes back for the fall semester. And that includes some of the things we're looking at with reduced occupancy in our buildings. How do we still do that? So even though we're talking about a phased return, it's still not going to be business as usual come September. It has to be a reduced occupancy in the buildings, and it has to remain where we can continue with virtual methods. We're going to continue to do so. It's actually the only way we can, I think, come back, and especially rolling into October and November when we start having the flu add to any of the pandemic concerns that are going on. That's all of our methodology to track that has to be in place, and all of our response teams have to be in place too.
So we're talking about not so much a new normal, a new abnormal. It sounds like that we're just going to have to be very flexible and adaptable and really do our work well.
I think that has to be how we operate for the foreseeable future. Yeah.
Brian, you heard from both Gonzalo and Dick and talking about testing and social distancing, and then from Tom about how we're trying to modify our university workplace. But what's that going to look like for business, and how are we still going to maintain our social and business environment in a way that's appealing and that gets people wanting to come to restaurants, wanting to be comfortable to come out? How do you strike that balance? You're muted, Brian.
sorry, it's good to hear that our local experts the messages are consistent with what we've been hearing, both nationally and all of us reading up on what we need to do. So I think the message that we've said all along is when we have the opportunity to reopen, we have to do it safely and responsibly. So that has not been argued by anybody in the conversation. Secondly, I think those parameters that have been so well articulated is what we're working toward, is that if a restaurant does open its outdoor patio, that it be socially distanced, to the ultimate degree, that everyone wears PPE, and that we practice the other measures. It could be sanitation measures in place to do the same. So I think it's a combination of things, Dr. Buckley. Nobody's going to wave a wand and confidence is there. I think the numbers out of China show that retail's only come back 40%, hospitality's only come back 30%. We would anticipate the same types of numbers here, and it could even be less. So what I'd say is it consistent with what Tom said about VCU. All businesses that I've talked to that have the ability, like Chamber RVA, to continue to work remotely, that's going to continue to occur. Secondly, those that have to open in order to be a business, those that have to have revenue in order to maintain their staff, they're going to do so under the strictest guidelines and in a responsible manner. So if we can balance that and, again, also manage the numbers, I'm encouraged by some of the numbers I see in my last state of Georgia. However, it's too early to tell. So nobody says just because there's been a couple of days of good numbers, we go back and don't be careful. So I think we trust our experts on this panel. We trust what we've heard from Dr. Avula and others. We've got to make sure we lead by example. The business community does want to reopen. They need to reopen in order to get the economy started, but do so safely and responsibly.
And this will be a good time to say, Brian, just how as consumers and people living in Richmond, how just incredibly grateful we are for all the businesses that have stayed open and that have been so flexible and adaptable. It's a great statement about the community coming together. Gonzalo, obviously, as we talk about population issues, and Dick talked about adapting testing to businesses, the demographics of the population and the age structure and even the racial composition could have impact on how you might manage situations. So what do we know about the virus and its preferential predilection for older people? Are younger people more immune? And then also, when you've answered that, tell us a bit about racial disparities. We know that that's a very great concern.
Right. So first thing I would say is we're learning more and more week in and week out. Without a doubt, elderly individuals or those with chronic medical conditions are impacted most severely by COVID-19 infection. We are also seeing, or have learned over the last several months, that minorities, particularly in the United States, are disproportionately impacted in terms of prevalence of disease and also clinical outcomes. So that's an issue. Younger individuals seem to have less severe disease. However, there's an important caveat. As the last couple of weeks, we're seeing or reading more and more reports, particularly in pediatric patients, of patients coming in either with active or recently had COVID-19 infection with severe secondary inflammatory syndromes, things such as Kawasaki's disease, not to get too technical, but severe syndromes that result in ICU level care. So I guess what it's coming down to is that although elderly and those with chronic underlying conditions have the worst or more severe disease, it's still a very potentially very dangerous virus for broad swaths of the population. So what does that mean in terms of businesses? Well, I guess I would say it kind of falls back to things that we were already referring to. On a public health level, testing and tracing has to be present to really make things safe. But at the business level, the availability of personal protective equipment, which includes masks and gloves, the availability of sanitizers or places for people to wash their hands appropriately is critically important. Then to maintain as much social isolation as possible within a business setting, 3 to 6 feet apart, not overcrowding restaurants or bars or factory lines or factory floors or any sort of business setting or retail settings, such that you can still respect that social isolation. And I think that's really what's critical. It goes back to the testing, tracing, personal protective equipment, and isolating as much as possible, even within a confined area.
Terrific. Can you address the issue of racial disparities? Because I know that was definitely in play in New York, but we've also looked at that in this city. So can you say something about that?
Absolutely. So it's without a doubt that we're seeing a disproportionate amount of COVID-19 prevalence and severity of illness in African Americans in the city of Richmond. That may have to do with crowding or living conditions, which increasing transmission. That also may have to do with access to healthcare, in other words, presenting at a later time and not being tested and isolated previously. And it also almost certainly has something to do with chronic underlying medical conditions such as diabetes, obesity, hypertension, renal disease, which would make the manifestation of the infection much worse.
Okay, okay, got the picture. So we take all of that. And Dick, I'm going to ask you the final question before we go to live questions. We've got some great questions for the rest of the group, but just to lead out this part with you, Dick, you know, we're going to get back. We're going to get businesses open. What do businesses need to be thinking about to keep the workforce healthy as we go into the summer months?
Well, let me start with something that doesn't have anything to do with COVID. If I ran a business, this would be the year I would want 100% of my employees to receive the influenza vaccine. And the reason is, imagine what it's going to look like in the fall and the winter. We're going to have the continuing COVID. It's not going away. It may rise even in the fall or winter. And then we're going to have the bump either in the fall or the winter of our usual influenza. And so this is going to stress business as well as stress the healthcare system. CDC's got enormous pressure coming at them, and I think they better begin very soon and sound the alarm. So I would say to business, develop a plan to promote and make sure your employees get the vaccine and have later on access, particularly high-risk individuals, to a drug like oseltamivir, but some drug as a preventive, because oseltamivir is a so-so drug for therapy, maybe saves one day a flu, but it's 90% protective as a prophylactic. So I would want that available for my employees, particularly those who are at high risk. Maybe they're immune suppressed. Maybe they're old. Maybe they have chronic underlying disease. And also, you know, the same group, if you have, as an aside, those people who are in nursing homes who comprise somewhere between 20 and 80% of cases. So for a business should have access to the drug for their employees as a preventive measure, and obviously masks. We're going to need masks not only for COVID, but for flu.
Yeah.
So that's to begin with. And then the rest, some of which has been mentioned already, but I think we have to give people confidence that their health is not in jeopardy if they go work for the business. And so you have to have testing, which I would say repeatedly done and repeatedly for the virus. You could use the new antigen test. We can talk about its weaknesses if you want, but some screening regularly. And then obviously you have to be able to, if you have people who really have physical contact with a lot of outsiders, maybe plexiglass barriers in addition to the distance. I would take issue a little bit with what Gonzalo said. I think the 6 feet is a good guideline. But dynamic studies of droplets have shown even large droplets can travel beyond 6 feet, even to 15 or 20 feet. So wear that mask. And I think it's important to do that, even if you're beyond 6 feet. I think that'll give, again, businesses the opportunity to say, look, we're doing everything. And again, have the hand washing, the alcohol around as much as possible. Contact tracing has to be available. And I think you have to answer the questions I asked earlier. How are you going to know if you're a success or failure? What's the trade-off? Do you have a cutoff number for anything that strikes as illness in your employees? They want to know that you care. They want to know that you have empathy, that you have the capacity to know that someone else's pain is important as your own. So I think that we really need to get empathy back there, and leaders are going to show empathy, and they will have followers. They will have people coming to their businesses. The chief block today to me is, do we have confidence as a group of workers to work for the company? And that's where the leadership comes to play.
Thank you. Hey, Dick, what was the name again of the preventative drug? I didn't quite catch that name.
Well, this is Tamiflu or oseltamivir, and I have no stock in any company, but I just mentioned that where it's been studied to have a wonderful activity as a prophylactic, it's really so-so as a therapeutic drug.
Okay, all right. We have a politics question, so Brian, I'm going to pose you a politics question. Just let me read it for a second. So a primary election is scheduled for June. For those who are working at the polls as election officers, what precautions should they take? Specifically, since they do not know who may be entering the site, should they be wearing masks, either N95 or other masks, to reliably reduce their risk? You want to take a run at that?
Well, I can handle the political side of it, but certainly not the medical side. But I'd just say it sort of follows what we're trying to do with this website we're going to release, to let everyone know there's a place to go for guidelines. I'm not sure what the local elections office would put out, but I think that what Dr. Wenzhou and others have said, I think PPE and other ways to follow the guidelines that we've all are getting used to. We need to stay away from people, wear masks, and just follow good guidelines. Use your sanitizer constantly, wash your hands. And so, yes, we got elections that need to go on. We need to make sure things that keep us a democracy happen, but we got to do it in a way that makes sure that we're giving people the confidence that they can come and vote by wearing a mask and see the workers. And again, we talked about we need to lead the way and help instill that confidence by leading by example.
All right, thank you. So one of the things even more important than voting is getting your hair cut. And so, Tom, let me ask you about getting your hair cut. Here's a question. One business that will reopen is Barber's. Unless all electric clippers are autoclaved after each service, how can this be done safely? And also, I understand the customer must wear a mask. How will the barber be able to cut hair? Tom, those questions for you.
Yeah, perfect. Clearly the perfect question to ask me. I would suggest that I don't know what the regulations are for barbers, but my understanding is that they do disinfect the equipment between each use. If you use an EPA registered disinfectant and use it according to directions, it's perfectly acceptable to use that. I'll defer to Richard or Gonzalo, but usually the active ingredients glutaraldehyde and these type of things, and it's pretty effective as long as used according to directions.
Great. Dick or Gonzalo, any comments?
I would add that those EPA-approved disinfectants, if used properly, are virucidal, so they should be effective in killing coronavirus.
Okay.
What I would say, Peter, we still have the issue of contact and social distancing. It's impossible to take a mask off and say that you're social distancing. So what I would say, there's some risk. And the real question, again, how much risk are you willing to take if you own a business full of barbershops or hair salons? When you're that close to other people, there's going to be some risk, and you have to define how much you're going to tolerate or not.
So we got a great question that came in from another colleague and good friend of ours, and that is, are there guidelines for summer vacation rentals? So Brian, are there guidelines for that, do you know?
The guidelines are coming out. Like I said, I just looked at the beta test again, and it's pretty robust. It's going to have links to almost anybody possible. Matter of fact, I'm a little concerned now it's got too many links, but we're trying to make it where it's the technology guys tell me 3 clicks, you need to be able to find what you need. So we're trying to go back through it a few more times to make sure that if I want the governor's guidelines, I can find them. I want local jurisdictional guidelines, I can find them. And then lastly, my industry sector. From a barbershop to a restaurant to a dental office, find that one page of guidelines that says, these are my best practices to make sure I'm being responsible and safe. That's what we want in the hands of our businesses. And yes, we're working on that. Okay, thank you. That'll be great news and helpful to people. A comment and a question here. All food handling persons should be required to wear masks. Why is that not necessary? Gonzalo, do you have thoughts on that? Do you think that's mandatory or not?
Sorry, I had to unmute there. So the question is regarding food handling personnel wearing masks. Is that correct? So
Yes, sir.
COVID-19 or coronavirus is not a foodborne illness. However, we certainly don't want droplets going into the food. So I would recommend that food handlers do wear masks. I don't know if it's a hard and fast mandate, but it certainly is something that will be reasonable in addition to washing their hands and wearing gloves. So that would be my recommendation. Perhaps Dr. Wenzhou has a different.
No, I totally agree with you. I think it should be 100% mandatory. The waitress comes out, delivers your food, should have a mask and gloves on. The people in the back, they're often very closely together. They're not quite as meat packers, shoulder to shoulder, but the distance is pretty close. And so I think just 100% rule, you come in here, you wear a mask.
That is actually going to be the rule for VCU, by the way.
Yes. Yeah. All right. Brian, did you want to come in on that issue?
Again, all the guidelines right now look to be pretty consistent with that. So yes, again, we're just, somebody, I think I saw in the chat, I was asking about the enforcement. This is difficult. I think right now the governor's guidance says enforcement will be covered by the health department. Well, most jurisdictions have just enough health inspectors to handle normal health inspection requirements. They're not going to be able to police every business that's open. So we're encouraging through all communications is we need to lead by example, make sure every business owner takes Dr. Wenzhou's comments is that we have to make sure we're above the standard. And so part of the marketing that we're putting out that people can display in their businesses is a message like we, the business owner, or we will practice best practices in making sure you and our employees are safe. If we can get that message out, then I'm going to be more comfortable going into a business and the employees are going to feel better about going to work. If we don't do that, we just make everything that's already difficult 10 times worse. So I'm being consistent with that message, and our business owners are adapting to that.
Great. Thank you. Dick, you did a great coverage of the testing, and we have another question that's follow-up and important from that. Let me just read it to you. Posted results show Virginia in the bottom 2 to 3 states in testing. Why is that? And then what is the time frame to move us to the top? And then the third part of the question also, is there enough testing capacity, materials, and actual tests in greater Richmond area?
Well, I think all over the country, we don't have enough testing materials, and everywhere you look. And it came out in yesterday's testimony where Dr. Fauci addressed the Senate. So we as a country are way behind in testing. The reasons why Richmond is doing poorly, I think I'd have to address that to the public health authorities at the state. I don't know the answer to that. We're one of many states that's, we're all behind. Why we're lower than the other ones, I don't know. It's not a record I'd want to brag about. And I would hope that people at the state health department are addressing it. And my guess is they are.
So, thank you for that. We got a question that I'm going to try to address is how severe is the financial impact from the virus on VCU health system, and what can businesses and individuals do to support VCU health? So let me just briefly answer that by first of all saying thank you for all your help so far. The community outreach and support for our system, for our frontline staff has been absolutely staggering and has really been a shot in the arm to absolutely all of our employees. So I can't tell you on behalf of all of us what that alone has done. But money is an issue, and we are a business, and we did the right thing, and we made space and prepared for a COVID increased volume. And then also we prepared other facilities in case even that was overreached and we needed further space. And then obviously we've stockpiled with testing and with PPE. And so we have tried to do what we felt was the right thing, just as Brian has been describing other businesses in the community doing the right thing. So it has cost us. Turns out, however, that while we did that, we never actually dipped below 50% of our hospital occupancy. So other hospitals have had greater financial crisis because they went below that number. And then, like anything else in life, not only is that vacuum greater, but it's harder to come back from that. So it turns out that the work of Gonzalo and others in preparing us and always being around 50%. And then also bear in mind that the demographics and the epidemiology of this virus, we're fortunate this city has not been as affected as other cities. So we've had a relatively small number of patients compared to other places like New York. So when you combine that, we had been in planning, and when the governor said it was okay to reopen elective surgeries, our team has jumped all over that, and we have greatly increased. I'm pleased to tell you that today we are at 80% hospital occupancy. And we've also really pivoted on telehealth, and we've gone from 78 telehealth visits a week pre-COVID to 4,500 visits a week now. It's staggering. And the other thing is we have services that much prefer telehealth. We're seeing more mental health patients by telehealth than we ever saw in our outpatients. And then we also continued some very important surgeries, obviously in trauma, obviously in cancer care. We've actually been doing more transplants during this COVID period than ever before. We've also been fortunate to work with our community, and we've retained a part in a managed care organization called Virginia Premier, but we also have worked with that and sold 80% of that. So that has given us some financial support. And then, quite frankly, we've had not just the support of food, outreach, and pouring, but we've also had donations, and we're very, very grateful for those. And one particular donation was a $1.5 million matching gift. And so we're in the process of seeking and getting that support for matching. Yesterday, Brian Thomas and colleagues received a $250K donation to our institution. And so the outpouring of not just support, but financial support continues. And we are also being very diligent. We've worked hard to try to manage the finances and play the long game and not do furloughs on the health system side. And again, I can tell you that our frontline staff are very grateful that they put themselves on the line and we stood beside with them financially. But it is certainly an issue. And one of the messages that we're trying to get out is that it is safe to come to hospital. It is safe to come and get care. And in fact, to do otherwise is a risk to your health, because there are reasons why people were coming for care pre-COVID. Many people had chronic conditions and they need regular care. And we've seen over time that care, when it's been absented or deferred, leads people to be sicker and makes the care more complicated. And then we've also seen reductions in heart attacks and reductions in stroke presentations. And strokes and heart attacks don't go away during a virus. So we are encouraged that from a financial management point of view, we've done a number of things through the business side to manage this to the best that we can. But there's also convergence between our ability to increase our productivity and our responsibility to the community to give the best exemplary care and do that in a safe way. And I can assure you that we are a safe environment and we are open for care, and we're also extending our care. We're open longer hours, we're open more days a week, and we are here to serve the community just like any other business. So I appreciate that important question. We have another question? Okay, when considering contact tracing in a business, should you consider face-to-face in social distancing guidelines, or should you also consider contact tracing when passing paper? Well, someone just passed me this paper, so I'm a bit worried about that. I think I'll ask Gonzalo to address this.
Contact tracing is something that's traditionally done by the departments of health to follow up on potential exposures once a patient is identified as having an infectious disease. So let's give an example. Let's say in a restaurant, the sous chef is confirmed to have COVID-19. Then by testing, and then the health department would then follow up with potential contacts of that sous chef.
Whoops. Okay, so
in that environment to find out who had spent time around that person. That would be contact tracing.
All right, Gonzalo, the good news is that you bear the Richard Wenzhou endowed chair, which means I can realistically pass this question to Dick because we're not able to hear you fully. So Dick, can you take up the banner?
Well, I mean, Gonzalo started to say, if you have an employee who's come down with an infection, there are what are called sometimes disease detectives that would then find out in many ways. Now we have with whom they had contact in the last 2 weeks, and then ask those people how much contact and if they would please quarantine themselves. Now, you know, the contact could be very brief, walking by, or it could be more intense, had dinner for an hour, and that's plenty of time to transmit the virus. So what we're trying to do is stop all the possible contacts as well as the original person from then passing on to another 2 to 3 person per person. So that's the sort of secondary effects. And again, how you do that, if you live in China, they've already got a hold of all your contacts because they have used AI, artificial intelligence, to tap into your location through your cell phone. That may not work as well in this country, but we have anonymous ways to track how much phones are, people are moving into high risk areas. So just mention that, but that's another technical way, and we have to decide where we're going to put technical assistance versus our own freedom to be free of being watched.
That's a great answer, Dick. Thank you. Tom, let me ask you this question. It's about temperature scanning and whether we're considering temperature scanning systems to capture temperatures as people enter buildings. And then, well, I'll ask, there's a second part to that, but why don't you answer that first?
Sure. So temperature screening is part of a process. It's not in and of itself. There's no silver bullet. So for us, how we're approaching this is we're relying on both our faculty, our staff, and our students to monitor their own personal health. Temperature screening for us is just going to be part of that. And it's going to be a daily part of that. It's going to be providing standalone temperature screening units, much like what I believe is already in the hospital right now at public areas. So both our residents, students, student, faculty, staff members can get a quick scan. But again, that's only one thing. It also then has to be the whole list of probably 10 to 11 different symptoms that we're asking our faculty, staff, and students to do daily checks on. And if they find anything, they would then report that to a hotline, which would go either to our employee health services or our student health services. And then it would go from there about whether we're going to, whether the Department of Health is going to get involved for contact tracing. But again, it has to, it's a personal responsibility. And temperature screening is just one of those things for the personal responsibility.
Where can people get those kind of thermometers, Tom?
So my experience, and I believe the hospital's experience, is that the handheld units, even the medical grade handheld units, are not very effective. What we're looking at right now is standalone units that are supposed to have a plus or minus of 0.5 degrees. If they legitimately have that plus or minus of 0.5 degrees, then it's a useful way of monitoring it. But the handheld units can have a plus or minus of 5 degrees, which if the temperature we're looking at, that threshold is 100.4 degrees, and we at 98.7 we have a plus or minus of 5 degrees. That's not really, we really do need that 0.5 degrees effectiveness. And the handheld units, to be honest, don't really have that. But I defer to the two doctors here as well.
All right.
Hopefully my internet connection's a little better. I'm in my hospital office. I'm not sure what happened. You are correct, Mr. Briggs, that those thermometers can be a bit unreliable at times and therefore cannot be exclusively used as the checkpoint for screening.
All right, great. Following on that, there's a great question, Brian, for you, if you would, and that is, will businesses be actually required to have specific risk reduction plans in order to reopen?
Again, enforcement's come up a couple times in the governor's press conferences and certainly the conversations we're having. There's been, even through this closed phase, the businesses that have been open, there have been people who've been concerned about people not following rules and being at risk. So they've called law enforcement and even 911. So I think it's a matter of, no, I don't think there's a standard practice right now. This is a very fluid moment. So we're trying to make sure through the communication we have, and I think also our public officials, is if we tell you these are the guidelines, follow them. Now, I think I heard the governor say today, if we have to go further with law enforcement, that is an option. But I think you just have to listen to our wonderful medical folks on this panel to say, if we do what we're supposed to do, we can get back to a better sense of reopening an economy that's got to be reopened. But if we don't do that, we're going to have a second phase, second wave, or other catastrophic effects that just really mess up things even further. So I don't know of anything specific just right now other than the encouragement and, again, publishing these guidelines. But I do think there's a willingness and an intent to make sure we all do what we need to do.
So high social awareness and then personal and professional and business responsibility is what I'm hearing rather than some mandated. Okay.
Exactly. Dr. Wenzhou mentioned, OSHA and other workforce practices. There's going to be a lot of ways that workers' compensation. There's a liability question being debated in Congress. Again, right. This should only be a last resort. We as business owners ought to do the right thing, take care of our people first, and certainly our customers who we want to have coming back again and again.
Yeah. Tom, another question. Is it a good idea for individuals to wear gloves in public or just to wash their hands?
Washing your hands and using hand sanitizer as often as possible is really kind of that's what we're promoting at VCU. Where we're looking at gloves, it's really going to be if you have a point of service contact. But again, it starts with administrative controls, which is social distancing, then engineering controls, mainly barriers, and then personal protective equipment. We're always going to be wearing masks, but the gloves are really going to be dependent on what your exposure is. So if you're at a point of service, yeah, you're probably going to be wearing gloves. But if you're just walking down the hallway, we're only going to be asking people to wash their hands often and wear the cloth mask. Again, a cloth mask rather than an N95 respirator, because the N95s, for our purposes, we want to, every N95 somebody just generally wears, we take it away from a clinician, and that's what we want to avoid.
Got it. Okay, that's very helpful. Gonzalo, let me ask you this question. I'll read it. With many parents returning to work, what's the best practice for children who are returning to daycare?
Best practice for infection prevention, I'm assuming?
Yes.
So that's a tricky question. I think that the best practice for children, to the extent that parents can control it, are daycare systems that are abiding by guidelines, that are not overcrowded, that's subject to some controversy as to what we define overcrowding, and also that allow for as much hand sanitation and individual, not sharing items to the fullest extent possible, which is very challenging in daycare systems. Then, of course, when the children come home, the importance of, it would be really important for parents to do their best to wipe down high-touch surfaces in the environment, and also to do as much hand hygiene as feasible, not only of themselves, but also of the children. I realize that's a challenge, but those are some common sense approaches.
Right. Okay. Terrific. Dick, a comment here. I've heard that the transmission from public restrooms is high. Is that true? And if so, how will we meet that need with more people out?
It's a tough question, but in fact, some insight from some studies from China have shown that they can actually find remnants of the RNA of COVID, of the coronavirus 2, in the air, in the confined space of a bathroom. So what we're talking about in general, if you step back and look at the big picture, if we're outside, we don't worry about, you know, airborne things so much, except the close contact with people. Once you get inside, whether you're talking about the 777 flying 8 hours to London, again, a tight space, and I would be worried that there'd probably be higher risk in the bathroom in that airliner than there is, you know, in a more open space with more air exchanges. Again, public bathrooms, no one's going to has shown data that says of 100 people who went there, this is how many. But the fact of finding viral particles in the air, meaning aerosol, not just large droplets, they didn't fall, is a little worrisome. And so one of the points I would make is, I think there's no question that some fraction of COVID-19 is spread by aerosols. And these are like microscopic hot air balloons encasing the virus that follow the air patterns for 2 or 3 hours and not fall to the ground in 3 or 4 minutes. How big that is, I don't know.
All right, thank you. So if you're flying to London, then you might wait 7 hours before going to the restroom. That's what I heard from you, Dick. Final question goes to Brian, and it's really, have you any advice for churches reopening?
Again, looking through the best practices that we've been collecting to put on this website for people to use. Again, it's not just businesses, but this website will be publicly launched so that anyone can go there to try to understand what's happening. But again, not being a medical physician, I think what I've read, the 6 foot, the social distancing, I think churches want to open. They want to get back to some communal spirit and being the fellowship that comes with the corporate religious experience. I would follow the same guidelines of the most intense physical location, again, that Dr. Wenzhou mentioned. If it's an open sanctuary and you're separated, you wear PPE, you're probably okay. But you probably don't need to be shaking hands and giving hugs and not wearing PPE. So again, trying to be consistent with the guidelines helps us all understand whether you're going into a hardware store or a church, you need to be careful, but also be cognizant of your fellow man.
Great. That's a fantastic place, I think, to end us out. We've really run out of time. I'm sorry that we did not get to all your questions. That's because there were a ton of questions, quite frankly, and each of them very interesting. I really hope you've enjoyed this. I want to thank our panel, Dick, Tom, Gonzalo, and Brian for your expertise, as well as, quite frankly, for your commitment to this community. And you know, when we talked about this earlier, we're fortunate in many ways. This is clearly a deadly virus, but it has not affected our community and our city to the same way that it has afflicted other cities. And then we're also fortunate to have a really vibrant and cohesive community. And so we have a lot going for ourselves, particularly in bringing this back. I want to thank the Chamber, you specifically, Brian, but also our entire business community for their support. And we hope that the admixture of business leaders with physician extraordinary experts, we hope that this has been a good opportunity to share our knowledge together on best practices. And hopefully it's helpful in your own work environment as you bring your own work forward. We have scheduled another one of these on Friday, this coming Friday at 10:30, and that's going to focus more on the health system and how it's reactivated its clinical services, and then some of the innovations, and then how that might be translatable again to business. So we hope you'll be able to join us as we continue that dialogue in the practice of bringing back our businesses. You can register for Friday at vcuhealth.org. And then also, if you have any questions, you can address them to VCU Health. The email's just gone up on the screen. If you can either move it over or I can give the full of it. It's VCU Health Development at vcuhealth.org. And then also, we're really delighted to be able to include the link to Chamber RVA website. Check out those materials that I think are going to be incredibly helpful. So I know we ran just a minute over. That's because we had great panel and great questions. Please join us again on Friday. And if you have any questions, as I said, that you didn't get to ask, we'd love to toss them to Friday. So thank you all very, very much. Be safe, be well, and we're going to bring back this city together. Thank you all.
Thank you, Dr. Buckley. Thank you, panelists.
Thank you.